I have been so looking forward to this conversation with all of you today with one of my favorite doctors I've ever worked with. I have an incredible team working with me on my tongue tie Marpe journey. And about a week and a half ago, I did an interview with Dr. Zaghi, who did my tongue tie release. And now we're going to do an awesome interview today with Dr. Manuel, who is my orthodontist and who has been handling all of the orthodontic care during this process. So I'll give you a little detail about him, and then we're gonna have him come on in and we're gonna start the conversation. And I wanna make sure that you guys, if you have any questions at all for Dr. Manuel, as far as anything to do with oral health, with the Marpe, with sleep, any of those issues, please, you can type them below and we'll try to answer them in real time. So Dr. Jeremy Manuel, or Dr. J as the clients love to call him, is dedicated orthodontist. He lives here in Las Vegas, Nevada, and he's graduated from UNLV School of Dental Medicine and completed 2 years orthodontic residency in Louisiana State University. He teaches part-time at UNLV and co-runs a successful practice with Dr. R. Cree Hamilton, which, little side note, all of my daughters had also gone to Dr. Hamilton, his partner, and got their braces. So we've come full circle with the family and their practice. This is what I really love about Dr. Manuel. 21 and a half years in the Army National Guard and an 18-month deployment to Ramadi, Iraq. He retired as a major in 2022. I have a soft spot for those in the military. Outside of work, he loves to hike and bike and support his kids' activities. He looks like a baby. I can't even believe he has kids. And this is why I went to him. He's passionate about advanced orthodontics and recently developed the Marpe 360 and Airway 360 online courses to enhance education on airway health and non-surgical skeletal expansions of all ages. Oh, that's a mouthful. All right, so let's bring him on and let's get this conversation started. So let me see if I can find him. Hello.
Hello, hello.
Sorry about that misunderstanding. I know we talked about, I think you kind of thought we would go there, but being that it's an Instagram Live, it's just easier to do it this way. So I'm sorry for the confusion.
Okay, no, I apologize. We were thinking that that you were doing an intro or something, and then we're going to be up. So my apologies. So we're here.
No
sorry for the delay.
worries at all. No worries at all. I'm just happy we're here. So I have given you an intro. I've kind of given a little bit of your background, and I've got quite a few questions that people have submitted to talk about today. But I thought we could first do let's see, can I introduce you? I guess, yeah, why did you get involved? Well, first of all, we'll say what is the Marpe and how you got involved with that, because I've already explained that you are an amazing orthodontist, but kind of tell me what led you to not just doing the Marpe, but being an expert and choosing to be an expert in that field.
Sure. Yeah, so basically we always start out with trying to get the most ideal result possible, and we use the tools that we have at our disposal in order to do that. And so we've always been big about getting the jaws right, especially in kids. So we like to see kids earlier. We like to look at the jaws in 3 dimensions. And when kids are younger, they don't need a Marpe. They don't need anything that's connected to the jaws typically. Most kids don't. And so you can do traditional expanders and you can make the jaws move. But 20 years ago, that was it. If you had any jaw problems and you were older, the only option you had was some form of surgery. And so about 10 years or so ago, there was an expander that came out that started to become popular called the MSE, or the maxillary skeletal expander. And the idea is that you connect the expander to the jaw through some temporary mini implants, and then you can expand patients that you didn't used to be able to. And so that was the underlying premise for why I ever looked into this. Long story short is that there's a lot of patients out there who have jaw size discrepancies, who either don't want jaw surgery or who aren't good candidates for jaw surgery for different reasons. And so having an expander that can make adult jaws wider, like in your case or other adults, opens up doors that didn't used to be there. So we don't have to send them for orthodontic surgery every time. We can do skeletal changes without surgery. So that's kind of what got me interested initially. Once I started using them, the potential for what these can do really became very clear to me. And also, there's a lot of little nuances about the expander. You've covered a lot of them on your channel already. There's things that you have to learn. So it's not really something that you can or want to dabble in. And so, basically, once I realized that, hey, this is something I either need to really, really do well or not do at all, that's when I made the decision, you know what, this is something that patients need. There's not a ton of people who are able to do them. So I'm going to invest the time and energy to learn how to do it well, and hopefully be able to provide patients with a great option besides surgery for those who either don't qualify or don't want full jaw surgery.
Great. Okay, so we're going to talk about my case specifically because I think we can really do we can cover a lot, with what it does. But I guess prior to that is what is first of all, everyone, if you can see it up in there, the Marpe expander is up in my mouth and it's with 6 screws. My question to you is, why would people give me kind of the blanket, what are the different reasons someone would come in to have this done?
So I would boil that down to 3 main reasons. All right. So one reason would be their jaw size discrepancy is so big, meaning their upper jaw is so small that their teeth can't fit together normally at all. So when they bite down, their teeth hit together and they start to destroy their teeth. They're worn down, they're cracked. They've needed root canals and crowns. And so one reason is just the health of the teeth. Because the upper jaw is so small, the teeth can't fit together properly. And over the course of their life, they basically wear down and destroy their teeth. So that's one category of patients who seeks it out. The next category would be those looking for airway changes, meaning that they've gone their whole life and they've never been able to breathe through their nose well, or they have been diagnosed with mild or moderate sleep apnea, and again they have nasal constriction. So one of the things that they'll look for is, hey, what can I do besides CPAP, or what can I do in addition to CPAP, or what can I do? What are my options if I'm not breathing well, especially if I'm not breathing well through my nose? So because the upper jaw is connected via the upper jawbone is literally the floor of the nasal cavity. They share the same bone. So as the upper jaw widens, the nasal passageways open, and it becomes easier to breathe through your nose. So the second category of patients would be those seeking correction for some type of an airway concern or issue with breathing. And then the third category would be aesthetics. They want to see their smile more broad. They want to see aesthetic changes like you had mentioned in the cheekbones or with the face. And so that would be the third reason that people seek it out, kind of those 3 main categories. And oftentimes patients will fall into multiple ones of those categories. They might have all 3 of those concerns or a combination of them.
Okay, so let's talk about why I came to see you. And in my specific case, because I really think this is a great, using me as an example will explain a lot. I had gotten referred to you by Dr. Zaghi. Obviously, I had started out the tongue tie journey meaning a dentist told me, you've got a tongue tie, you should get that, hey, you got to get that fixed. And I'm like, what? I went down the rabbit hole. I was referred to a myofunctional therapist who I'll be interviewing soon, Minette, here in town. And she said, we started working together. Started doing myofunctional, all the exercises to strengthen the tongue. She measured, I had like a level 3, almost 4 tongue tie restriction. So I knew I was a candidate, but we did a sleep test, we did C-scan, and realized that I had what the doctor that did the scan I had one of the smallest airways she'd ever seen. And we knew at this point that I would need really a specialized person doing my tongue tie release to really manage this. So I was referred to Dr. Zaghi. On that call, on my Zoom call with Dr. Zaghi, I was thinking, this is going to be great. He's going to do my pre-approval. I'm going to go in a couple weeks to get it done and I'll be all good. But no, Dr. Zaghi looked at me and says, I won't do your tongue tie release because it's too risky. Your airway, your upper palate is way too small. And the only way that I will touch that is if you get the Marpe expansion. And as soon as he said it, my heart went, oh, because I knew it was going to be like having something screwed inside and the gap and all of that. And then I said, okay, and I'm like defeated. And he says, there's 2 options, which was amazing. 2 options. We have a doctor in LA in his practice, or he goes, and there's a Dr. Manuel in Las Vegas. And I'm thinking, that's awesome, in Vegas. And then he says, I think it's Hamilton. And I'm like, Hamilton? I said, that's where my kids got all their dental work was with Dr. Hamilton. So it ended up being such a small world. I called the office, and within 2 days, you guys got me in, or maybe it was the next day. we sit down to meet. So we sit down to meet, and you give me, you took scans of took scans of everything, and then we sat down. We looked at my sleep scans. You looked at, I think maybe some notes with Dr. Zaghi, and why don't you lay out what happened that day, kind of the options and what you were thinking, because you were kind of concerned too about even it seemed like you were pushing me to the CPAP, and I was like, no.
Yeah, it's interesting because, a lot of patients will come in with airway concerns, but they've never actually had a thorough exam and diagnosis. You were the opposite of that. You'd already received multiple, you had a lot of information coming in, which was good. So, my role and my job is when you come in is to make sure that, a Marpe is something that's going to address your needs and get you the results that you're looking for. And so one of the biggest things that I'm looking for is an actual jaw size discrepancy. So there may be patients out there who have, normal sized jaws, but they still are having airway issues, or they're still having other concerns. So it wouldn't be wise to expand an already normal sized jaw in hopes that, things improve when it doesn't seem like the jaw size is really what's causing the problems to begin with. So in your case, we talked a lot about, the options that you had, and you had a mild jaw size discrepancy. And if you want to later, I can show you some imaging kind of where it was and where it is now.
I would love to do that. That would be awesome. It also gives the viewers really an understanding of what we're talking about. And I think too, I have to say, I think that, through my own journey and sharing this on social media, there are so many other areas, not just a tongue tie, that this can benefit. And I think people have been kind of scratching their head and a bit curious of, wow, this may be able to benefit me in an area of my life, not necessarily the tongue tie, but in some other area.
Absolutely. Yeah. So, I mean, the first thing is just to get looked at. So with the 3D imaging, it makes it really nice. 20 years ago, we didn't have much in the way of 3D imaging. So all of our diagnosing was off of, 2D flat images, which are hard to measure off of. So now we can take a look very specifically and just look at your jaws and just measure it out, top compared to bottom. How big is it? The upper jaw should be wider than the lower jaw by about 3 to 5 millimeters for everything to fit ideally. And so, yeah, I'll pull up kind of what this is. It's your superimposition from where your jaw was to where it is after the expander.
We all love a good before and after. We love a good before and after. This is gonna be great.
Yeah. So, well, I mean, it's obviously not as glamorous as maybe the as the photos will be. But when you look here, this actually shows, and I'm going to play this. It's going to go back and forth, and you can actually see the bone moving. So you can see that in your case, your discrepancy was fairly minor, and we expanded a little bit more than this. But you can see that gap forming in the middle here, and the jaw expanding out as that expander takes place. So that's kind of a superimposition, the initial X-ray versus the progress X-ray. And then when you look at that from the top, you can actually see the changes in the jaw itself there. So that is the jaw expanding. I'm going to get a little bit closer here so people can see.
Kind of point to where it is, because it's kind of a little hard to understand.
So this, you can see it best here. You can see this image. This is kind of the gap that's forming right in the middle there.
Okay.
One more time. Yep. And I'll show you the other view one more time, a little closer up. So I'm going to show you another one now, because that's a minor jaw size discrepancy. So I'm going to show you an adult male who had a much larger jaw size discrepancy. So let me pull this one up here, and you'll be able to see this a lot more clear because it's a bigger discrepancy. Okay. So do you see here in between these two parts?
Is that before?
So this is before. Yep. And then we'll play it back one more time here. So this is before, and then you'll see those separate. That's the after. And you can see this is the cheekbones all the way up here. So to your point, as you see those go, you'll see the cheekbones widen because this upper jaw is connected to the entire facial complex here. So this is where the gap forms, and this is where the jaw gets the widest. And then up here, all this other bone, the cheekbones, the maxillary sinuses, all this is bending as the expansion is happening. And so from a front to back standpoint, again, this is a patient with a little bit bigger, but do you see how far forward this jaw is moving? So this is the profile view, and you can see here from before.
Oh, wow.
And then after. We'll play this one more time. So from before and then after, you can see the forward movement of the upper jaw as well. That is a function of expanding. The more you expand, the more the jaw comes forward. And so you can see here, in his case, that needed to come forward in order to get the teeth to fit together. So this patient was in the category of needing expansion because of his teeth. So when we look here and we kind of look at the difference in what his teeth look like. And I'll move these a little bit so you can see him. And we'll shrink this down just a hair here.
So this is the gentleman's mouth of the scan we just saw?
Yes, this
Okay.
is the mouth of the scan we just saw. And you can kind of see initially where the jaw didn't have any room. There was no room for the teeth. They just didn't fit together. The teeth would continually break down. And then after the jaw was corrected, you can see that they're able to be aligned.
Now, these are all his natural teeth?
That's correct. He's probably, let's see, yeah, he has some fillings on some of them, some of the teeth that have broken down. And it looks like he has a crown on the very back left one there. But overall, these are all his natural teeth.
But it looks amazing. Like, the difference is remarkable.
Well, and you really see it too when you actually look at the difference in the jaw width itself. So these are reversed. Here we go. So when you look here, you can see, you know, this is where the jaw was, and then this is where the jaw is.
That is beautiful.
And so that's the type of expansion. We didn't used to be able to do that without jaw surgery. And so this patient, you know, I told them when we started, you know, we're probably going to need to do jaw surgery. The discrepancy was so big. But it turned out that he expanded well and everything was went really, really good. And so we didn't end up having to do jaw surgery on his case.
How long did it take for his expansion to get that?
Yeah, so the expansion portion, he was turning it for about the first 2 months. And then afterwards, the expander stayed on for an additional 5 months. And so he had an expander in total. I think it's about 7.5 months total. So a little over.
Brilliant. It looks amazing.
Yeah,
amazing.
He did phenomenal. I mean, he really just, like I say, when they respond well and they do what they need to, they keep everything clean. And you got to give it time. You know, if you try to expand too fast, you can have complications. So he did everything exactly like we explained it to him, exactly like we told him to do it. And he was able to get a lot of expansion even as an adult.
How old is this patient?
He's in his late 40s.
Okay, so that gives you hope, everyone out there. You know, I'm in my 50s, and it's never too late. I think you said your oldest patient was in her 80s.
70s.
Is that not what I'm?
Expansion was in 70s, yeah.
Yeah.
And and so, you know, once you're past about 25, 30, I mean, the physiology is very, very similar. So the only thing that comes into play is medical history. So I mean, obviously, you know, the older you get, sometimes the medical history gets more complex, and so you might not be a candidate depending on your medical history, but the bones respond in very similar ways.
Okay, so we're back to my consultation day. You looked at my charts, you looked at there's a discrepancy, and like I said, you were, you know, a little hesitant, kind of saying, you know, maybe you should do the CPAP. You also talked about the structural change, which did scare me, but we sat down and showed me some patients. So talk about that, because obviously you can change the facial structure for good, and you can change it to look really distorted and, you know,
That's correct.
Not good. So talk to me about that.
Yeah, so you know, it's funny because I probably talk more patients out of expansion than I do into it, which is ironic because I want to make sure that they know and understand all of the implications, because in some patients, like you mentioned, everything is a benefit. You know, the facial changes are a benefit, the jaw changes are a benefit, how much they show when they smile is a benefit. And in other patients, there's kind of give and take. So yes, the jaw's expanding, but maybe it's at the expense of something else. So when you expand, if you're expanding, you know, somewhere between 2 and 4 millimeters, the facial changes are going to be pretty minimal. And you might notice them, like you notice them because you're super into, you know, you're looking all the time and this is your world. And so obviously you've noticed the changes that are there. And in your case, these were positive changes.
Yes.
But sometimes the amount of expansion that you would need in order to either A, correct your teeth and bite, or B, get the aesthetic changes that you want, may cause the cheekbones to go too far, or may cause the face to elongate too much. And if that's likely, then I'm going to ask you to consult with the surgeon so that you can go over other options that may not change the face in ways that you don't want.
Right. The nose. Everyone talks about my nose. Is the nose going to get wider? Is the nose going to get wider? And I also know that you were very specific. Dr. Zaghi was very specific about how much he wanted. I know you were kind of hoping for a little bit less. You guys negotiated and it ended up being great. But you were just like, it's that fine line of so many turns that if maybe I did 10 more turns that could have altered that.
It could have definitely changed everything. I mean, a couple millimeters at that point can definitely change the way everything that looks, and also increases your risk for, you know, for some type of complication if you expand too far. So when you're going through that expansion process, it's really, really important to be in close communication with your doctor to make sure that we can monitor everything every step of the way. So just like when you were going through the expansion process, I mean, you were submitting photos every single week, you know, smiling selfies, so we can take a look every single week throughout your turns to make sure that the changes that we're seeing are what we want to see. And once we got to that level where the jaws were aligned, and that's when we reached back up to Dr. Zaghi and had him take a look at everything, and it looked really, really good. So we were able to move forward that way. And the facial changes that you have are pretty minor, but also pretty noticeable in a positive way, which is great.
Yeah, it's funny when I look at the before and after pictures with Dr. Zaki, he actually pulled up my, some shots he had done for me during our consult, and it was marked difference. All right, so take me back. We were sitting there, and I'm like, I'm going for it. What was the action plan that you put out for me? You gave me the whole plan of what was going to happen from here, point A to point B, or to end to beginning to end. So tell us, what was that plan that you gave me?
So the whole plan, sorry, I think I caught most of what you're saying. The whole plan from the very start to the finish, what that looked like? Yep. So basically, when the upper jaw is expanding, it's difficult to expand the jaw and move the teeth at the same time unless you have braces on, right? Braces can allow the teeth to move a little bit. So because you weren't looking for braces, then what we do is we start the upper jaw expansion, and at the same time, we're starting to wear aligners to move the lower teeth outward, so that once the expansion is complete, the lower teeth now fit the correct sized upper jaw. And then once the expansion and the turning portion is complete, that's when we added your aligners on the top so that we can start actively start closing that space and closing those gaps. And then once that's really close, then we scan both arches together, and that's when we fine tune the bite, the occlusion, finishing closing up the spaces and get everything dialed in to where it fits comfortably. You can probably attest, as you're going through that process of expanding and wearing the aligners and the teeth are moving, your bite probably feels all over the place for a little bit as you're hitting more on one side than the other, and it's different as those changes are happening. But it's a process that we start with the big changes, and then we work our way down until we get to the smaller changes, and then that's all the fine tuning at the end with the clear aligners to make sure that the bite is comfortable, all the spaces are closed, and the roots are where they need to be.
Okay, so at first you gave me, I want to say the timeline was going to be 19 to 23 months, if I'm not mistaken, from start to finish. Now I know that it has seemed like we have been at turbo speed, not because we've been pushing it, but because my mouth has been so beautifully responsive to everything that we've been doing. Which, because I think we started this, I'm trying to think how long ago. It's been maybe 7.5, 8 months max that I've had the expander put in.
That's correct.
And my gap is almost closed up. So let's stop for a second. Just so people understand, aligners are basically clear braces, right? They're trays. And I actually I brought my little, so I could show them because I thought this was really cool. What happens is they take a scan, and I've shown that in my prior videos that I've shared. They take a scan inside my mouth. It's so cool. They can do 3D, and then they make these literally of your teeth. And each week, we initially said it was going to be about 2 weeks for each tray that I would wear, but we would do a weekly checkup, and mine has turned out to be about every 8 days. But I want to show you guys, this is what this looks like. So this is kind of is it a clay or some kind of clay mold?
Yeah, so it's a 3D printed resin is what the mold is. Yeah, so it's actually 3D printed on a 3D printer, and then the Essex material is the what the actual aligner is made out of. It's a plastic type material, and it goes right over the models, and then that's how those are generated. Each of those models moves the teeth a little bit more, a little bit more, a little bit more. And so we set it up to be, the normal speed that it would take most people about 2 weeks to get through. But then we're monitoring, so every time you're changing the aligner, you're scanning, and depending on how well you're wearing it and how well they're fitting, then you can potentially reduce the number of days down. So you started at 14 days, but now you're down to 8 days. And shrinking that wear time down, as long as everything's tracking well, really can cut a lot of time off of your treatment. And so the better you wear the aligners, the more diligent you are about making sure they're seated on the teeth, they're not popping off, you're not having them out, too many hours during the day. Those are the things that are really going to pay off as far as your treatment time goes, and being able to, reduce the treatment time by as much as possible. Yeah. And so, you're definitely on track to finish a little bit earlier. I never like telling patients that because that's all they hear, but you've definitely progressed really, really quickly. And so, once you're done, you're done.
Okay. So, I had, prior to coming into you, I was already working with another dentist with some clear aligners. But then you said, look, I'm going to be working with you. We're going to do the whole process, which I'm grateful I did because it makes total sense. But what I do notice, and I want to point this out, and it's been brought up a few times to me, many times. When I came in with my aligners, I had are they called tags? Is that what
Attachments. So we call those attachments.
attachments?
Yep.
Okay, I keep on tags. I had no attachments on my aligners from the prior doctor, but you're like, we're going to put the tags on. Now, some people, they're not the most attractive things. They're, you know, they do get a little yellowed. You can kind of see mine.
Yep.
But why? What I can say is, as soon as we put those on, and you know, the difference from having the aligners prior to, which I think I'd gone to maybe like tray 8 or 9, so I'd had them on for a fair amount of time. There was no comparison to the movement of my teeth having these attachments. I got them here. Do you think there's like 6 kind of on upper and lower to help? So talk about that for a second, why that's so important, because I see people all the time with aligners, you know, out in the wilderness of social media that don't have the attachments. And I just keep thinking, get the attachments.
Yeah. Yeah, you know, it's really what it is. What an attachment is it allows the plastic of the aligner to grip the tooth more firmly, essentially. So if you don't have attachments, what tends to happen is that your teeth will follow like so kind of close, but they tend to slip off the teeth a lot more. And then you end up having to try and go back and redo the movements that you've already planned because they didn't actually play out because there was nothing to grip onto the teeth. As it relates to the expander specifically, I mean, when you get an expander, those teeth in the middle, they separate and the roots are still upright within the bone. So they're like this. And eventually we need the whole tooth to go in and actually be upright within the
And
bone.
not this way
exactly. So what they want
out.
to do, because of where the roots are, they want the top part of the tooth wants to move in, but the root doesn't want to move. So that attachment gives a little extra grip on that tooth to be able to upright the root as well, in order to make the movement not only predictable, so that you're not going over and over and over, another set, trying to get the same movements, but it also helps to have that movement happen faster. And so, you know, the attachments, we use as many of them as we need. So there's a lot of teeth that the movements aren't that demanding. That, you know, they're going to happen with an attachment or not, so we won't put attachments on those teeth. But the teeth that need those really specific and exact movements, we're going to add attachments on to help make that predictable. And again, to keep you on track so that you're not going over your treatment time. And if anything, you finish early.
Okay, so we're going to talk about the Marpe expander for a moment. So we had it expanded, and obviously I was super scared. The thought of having 6 screws, you know, literally screwed into the roof of my mouth. It was, I was so panicked about it. You were incredible when we, you know, ended up taking about 4 hours, but not because that took so long, but it was all of the numbing. I was completely numb. I felt nothing. You have the gentlest touch when it comes to needles. So I literally didn't even feel the first poke. It was so beautiful. But obviously it was mentally, you're worried about it. Now tell me, you also did something else, corticotomy. Is that what it's called?
Yeah,
So
corticotomy, osteotomy. Yeah, we can go through that. So basically, let me pull up. This will be easier here. Let me pull up an image, and we'll look at this together because that'll be easier. Okay, so we'll pull that one up, and we'll pull this one up.
And is this typical of? Do you always do these when you the split when you do a Marpe?
Not always.
Not
And
always.
so there's a couple of things that we look at. Yeah. So let me pull this over here. So this isn't you, this is the other patient I was showing you before. So this area here is the connection between the two halves of the jaw. So this patient's, you know, you can see they're looking off to the side that way. Okay. This is the bone that's in between the jaw. So when you are young, and I'll pull it up in this view too. So let's look here. So this is the view from, and I'm gonna go back here and right here. Okay, so this is before. So this is the middle of the jaw. Now, in order to have successful expansion, this middle of the jaw has to separate completely. So this basically has to, these two halves of the top jaw have to disconnect from one another and then expand outward. So that's when we have successful expansion, that's what happens. And you can see here, I'm just going to scroll this forward a little bit. You can see that there, those two halves have separated. Now, with an expander alone, sometimes you can get these two halves of the jaw to separate. With kids, they essentially always separate. They're separated to start. So like a 7, 8, 9-year-old, 10-year-old, even a 13-year-old, those two halves of the jaw have not really fused together yet. And so they're already two pieces. So you don't need to do anything to help those separate. Now in adults, and you can sometimes see this on the x-ray and sometimes it's not as clear, but in adults, those two pieces of the top jaw are interwoven more intimately. And depending on how interwoven they are, will depend on how difficult it is to expand. So a corticotomy or an osteotomy is a procedure. It's about, and that's what we did with you. It's about a 1/4 millimeter thick. It's basically a little, it's called a piezotome. It's a little instrument that vibrates. And what it does is we go down through just that middle area on the top of the palate, and it removes about a 1/4 millimeter of the bone in that area specifically. So that when the expander goes in, it has less bone that it has to pull apart, because we've been able to physically separate the bone in between with again, about a 1/4 millimeter instrument.
Okay, and I didn't feel any of that. Like that was like I said, that I didn't feel any even after the fact when things wore off as far as any kind of medication. That never interesting as invasive as that sounds, it didn't cause any any discomfort. Now the next thing is then I had it in and I was surprisingly, the first few days were great. My pain came when I was doing my turns and you could feel that pressure, but it was kind of like a cool, kind of good, weird pressure in a way. And then when I got the split between my two teeth, and I thought, oh, I had read, oh, then there's no pressure, no really pain after that. Well, I got my most pain really that for about the couple weeks after that turn. Certainly that was pretty intense. Luckily I got past it, and it was, Tylenol and Motrin, took care of that kind of around the clock. But then it kind of went away. Then I started getting the expansion, and then of course the questions became is, how you, in my mind too, am I gonna need, I assumed in the beginning, when I was speaking with another doctor, I was told I was going to have to put some teeth, like some fake teeth, veneers in to replace, because I'm going to have this big gap. And you're like, no, we're not doing the gap. So explain to people what happens. We get this big gap, and I have I can stick my finger pretty much through the gap. How does it close back up? And how do we, how does it close back up? But also, how do we rebuild the bone?
Yep.
And that we're moving it forward. Can you kind of explain that whole thing? Because that was a lot. I got so many questions about that.
Yeah. And I'll pull up an image while we're doing that so we can look at it as well. So we'll pull up these images again. So, and again, this is much more of an expansion, right? So all of the space that eventually ends up here starts out here in the middle. And so there's a couple different ways you can do that. So like if you were to try and put 2 more teeth in, let's say, or something, that would be a lot of volume to try and fill. So let's say you have a 6 millimeter gap. Well, one tooth is, 8 millimeters. So, okay. I mean, one tooth is too much room, if that makes sense. And so what we're doing essentially is the gap forms here, but then we're using either the clear aligners or braces to move these teeth forward and fill the gap by moving these teeth forward versus trying to move these teeth back to fill the gap. So, and that's how we're able to create a bigger arch form, meaning the arch ends up wider, but you don't end up with all those spaces. So essentially, once that gap forms here, we're going to be using the clear aligners or the braces to help move all these back teeth forward and fill that space by moving those teeth forward. In this case here, you can see his teeth on the side were actually a little bit small as well. And so we ended up having those bonded to be wider or normal length as well. So that helped to fill part of the space also. So it does depend, it is case specific as far as, how you close that space. If there are small teeth, then of course we'll work with the restorative dentist to make those teeth the right width, and that'll fill up some of the space. But most of the space is closed by moving those back teeth forward into a new position and filling the space that way.
It was interesting because so you move it forward, which also is all part of the lifting and looking like, giving that like an accidental facelift. But that is interesting when you look at the pictures because he expanded and it's a beautiful broad smile. But it's not like you would think when you were doing that the teeth, everything would move up and you wouldn't have teeth in the back. If you're going to somehow, but I guess it's just the whole, it's the same amount of space, but yet you're just, moving the space around.
Correct. Yeah. And the more forward it is, the more you show it in your smile. Okay. So typically when people smile, they might show to the second premolar or the first molar, which is about, this area here or this area here. Okay. So there's still 1 or 2 more teeth back behind there. Right. So exactly. That wouldn't normally show anyway. So essentially when you're looking from the front, you're seeing basically You're never going to see all the teeth, but you're going to see more of the teeth the more forward they are. So as we've been closing the space with your smile, that's what we're seeing as well. You're starting to see more of those back teeth in your smile, and that's because the overall width is more broad now.
Okay, so we have, the whole goal is to broaden the upper palate, move it forward, put the teeth back together beautifully. Now talk to me about, we know we split the bone in the center, and we need to rebuild the bone.
Yes.
So talk to me about, how does the body rebuild the bone? How long does it take to rebuild the bone? And how long do I wear the expander in that process?
So, the bone building part is the best part. That's Mother Nature's job. And so essentially, just like if you were to fracture a finger or an arm or something else, if there was ever a split between two pieces of bone, the body recognizes and realizes that those two pieces of bone are supposed to be connected. And so if you give it enough time, the body's going to fill in that area with new bone substructure. And then over the course of about 5 months in adults, it will harden and become new bone. And so that's the process that happens. So when we're turning, we're creating space. The body's realizing, hey, something's happening. These two pieces of bone that used to be together are no longer together. And so it goes to work right away, laying down the substructure that will eventually become new mature bone. And the reason that we keep the expander on approximately 5 months before we actually take it off after we're done turning is because we want enough time for that calcification and hardening of the bone to take place. So if you were to remove it earlier, you would notice that some of that expansion would be lost, essentially. So the pressure on the upper jaw itself on both sides, as soon as that expander comes out, if the bone isn't mature, it will constrict and you will actually lose some of the width that you obtained. So if you keep it on approximately 5 months after the turns are done, then at most you'll lose about 10 to 12% expansion, and that's kind of what we plan on. So when we're turning, we'll expand about 10 to 12% more than what we actually need, and that way when the expander comes off at 5 months, we're not settling for a suboptimal result. We've already planned that in or baked that into the equation, and so we have the ideal expansion after that settling has occurred.
I asked you this before because this is my panic. As much as I'm excited because we have it scheduled for September 23rd to take my expander out, I'm like, I said, are you sure it's going to be strong enough? Like, I'm like, if it needs to stay a little longer, because I don't want to lose any expansion because I'm so happy with the results. But is that 5 month mark after the completion of the turns, we've got the space that we need? Is that kind of like, it doesn't matter if you kept it for 6 months or even if you kept it in there for a year, God forbid, after it's not, there's no proven improvement?
Yeah, there haven't been a big enough subset of patients who wanted to keep their expander in a year to really test it. So we started out keeping it in only about 3 months, and that was based on the literature that we had from growing patients. So when you have a growing patient, I mean, their bone will solidify and harden within about 3 months. But non-growing patients, we found that it takes longer. So when we were taking them out earlier, we were noticing more relapse. And so we started, we go to 4 months, we go to 5 months, and 5 months seems to be the place where it kind of settles in and we get the most expansion possible, losing the least if possible. So that's kind of how we've settled on that number. Now, if research comes out in the future and it's showing that, hey, we need to go 6 months, or, oh, you can actually do 4 months, I mean, we're definitely open to that. And it's certainly a little, it's patient specific as well, right? Everybody's body is going to respond slightly differently. But the vast majority of patients, if they keep it on 5 months after the last turn is done, that's plenty of time for the bone to harden up and allow for the least amount of relapse possible once it comes out.
Now, do you do another scan on me just to make sure that bone is good and solid before we take it out next month?
So typically we won't re-image right before we take it out. We certainly can. We can take an image at any point. But when you look at imaging of the bone as it hardens, I mean, it's not that whole 10 to 12% at the end. I mean, it's not going to be completely filled. Probably for upwards of a year before it starts to look like the normal bone on the other side. And so, it's always going to look a little bit different on the x-ray immediately when the expander comes off. It's not going to look the exact same as the bone around it. But again, when we measure it out, it's about 10 to 12%. And so that's definitely within that's a very manageable amount. So we can, turn it an extra few turns before, which is what we did in your case, so that when the expander comes off, that 10% or so is not significant. It's not going to affect us in a negative way. We've already accounted for it.
When you have that, say 10% or 12%, is there any risk that you may have to keep your aligners on longer or adjust the aligners if that shifts? That sounds like it would affect your bite
Yeah.
potentially.
So that settling is happening while you're actively wearing your aligners. So as you're continuing to wear the aligners after the expander comes off, I mean, the jaw is doing what it's going to do. You're having that minor, retraction, I guess is what we could call it.
Right.
But you have your aligners keeping the teeth on track. So even though the jaw's moving ever so slightly, those aligners are keeping the teeth where they need to be. And so essentially, the teeth are moving within the jaw regardless of what it's doing. And so to answer your question, no, as long as you're wearing your aligners and they're fitting, then the teeth are going to end up where they need to end up, despite what the jaw is doing during that final healing process.
Got it. And so we just did more scans because I'm on my tray 10. And so now it's going to be, like I said, probably I'm very close.
Yeah.
That being closed. In fact, today was the first time I had no tipping of teeth, by the way, until today. I noticed, and I panicked. I sent a picture to your girl. She's like, this is all good. That this tooth tipped slightly in, and I'm like, ah. But she said that's normal till the root goes over.
Yep. So the crown's going to move first, and then the root will upright. So as you continue to wear these new aligners, which you'll see each one of those is going to help with the tip just a little bit more. And then when we finish, the tip of the tooth is going to be upright again, and all the spaces will be closed.
Okay, got it. All right, so I'm going to do some rapid fire questions now. So here's what is it? We know what the Marpe expansion is. How does it differ from traditional palate expansion methods? We kind of said this, but
Sure. Yeah, I mean, basically the difference is you can do it on patients that you didn't used to be able to do traditional expansion with. So, and this is actually a really great question because people have, they hear expansion and it's just like a one word fits all. But there's a difference between skeletal expansion, which is what we're talking about, moving the bones itself. If you look it up in the research, you might hear it called orthopedic expansion, but basically it means moving the bones. And then some people talk about expansion, they just mean moving the teeth. Right? Mm-hmm. So if you're just moving the teeth, some people might call that expansion because you can expand where the teeth are, but that's not the type of expansion that we're talking about. So to expand the teeth, there's a lot of different things that can do that. I mean, clear aligners can do that, braces can do that, different appliances can do that. But when we're talking about skeletal expansion, we're talking about moving the bones themselves, so orthopedically. And so that is what is happening with these types of expanders versus what others might call expanders, if that makes sense.
Dr. Nora Zaghi is just giving you a hello.
Hi, Nora.
All right, so let's see here. And so basically what patients can expect during the treatment of the Marpe expander, we've kind of covered that. Maybe you can give a nutshell of the new person. They're going to come in, they're going to get it installed.
Sure. Yeah, absolutely. So they'll come in, we'll measure, we'll see how much expansion is needed. We'll select the type of expander that's going to get that. So obviously in kids, there's a lot more options than in adults. And then of course we take into consideration all of the factors, the age of the patient, the bone, what that looks like. Once we've selected the expander, if it is some type of a Marpe or a skeletal expander, then we'll go through the process of having that custom made and fabricated for that patient. Then they'll come in, just like you, they'll be completely numb when the expander is placed. If there is a corticotomy or osteotomy that's recommended, they can do that as well. And then after that, they'll start the healing process. We kind of give them a break after the expander is placed for about 5 or 6 days to allow everything to start to heal up and feel a little bit better before those turns actually start. Then they'll start the turning process, and the jaw will get wider and wider. They'll get a gap between their front teeth at some point. That's a good sign. That means that initial split has happened and that the two bones are separated. And at that point, the turns slow down significantly because at that point, we don't need anything else to split. All we want is for the jaws to continue to bend and to mold as they expand. And so then we slow down the turns. And then once we've obtained the amount of expansion of the bones that we need, then we stop turning the expander and we let the bone healing start. Meanwhile, we're going to be closing the space orthodontically with either clear aligners, like in your case, or braces. We didn't talk about that in detail, but one of the benefits of one versus the other. So some patients will choose braces over aligners because it does move the gap closed faster. It can actually close the gap a little bit faster. And so some patients are like, well, I'd rather just have braces on and close the gap faster. And others are like, no, I'd rather just have the clear aligners on and close the gap that way. There's no right or wrong answer. It's really what's going to fit best into your lifestyle. But those are the biggest differences between the two as it relates to closing that space afterwards. And then once the expander's had 5 months, it comes out, and we finish moving the teeth until the bite is settled and all the spaces are closed, and then you have retainers at night. And that's pretty much the entire process.
And you said, so again, you guys can kind of see up there. I wish I had it because you could actually see it, but I asked you, is it going to be hurt? Is it going to hurt when you take the expander out? And you actually said, for the most part, most patients don't even get any pain medication. They could, but like 80% don't.
Yeah, typically, so when it comes out, because it's basically kind of an unscrewing motion, so there's not really anything traumatic about it. It's just unscrewing the pins. And so I would say 4 out of 5, maybe even 4.5 out of 5 patients, 9 out of 10 would prefer not to be numb. And so typically what we'll do is we'll just start removing one of the pins, and you'll see what it's going to feel like as the pins come out. And if it bothers you, then we just get you completely numb again. And if it doesn't bother you, then we just take the rest of them out. So it's definitely, getting it in, you have to be numb, right? There's the whole procedure you have to be numb. But getting it out is pretty benign in comparison. It's a quick procedure, and essentially it's just removing the pins and taking the expander out. So it's pretty short.
So once you have those out, and I asked you, there's going to be holes. Like I said, what's the healing process of the holes and taking the expander out?
So, vast majority of the time it's just going to heal up naturally, and you don't have to really pay extra attention to it. But to your point, the pins do go all the way through the bone. And so basically the mouth is connected to the nose through that bone. Mm-hmm. And so you just want to avoid anything those first few days, about 3 days out, that would create a lot of extra pressure between the nose and the mouth. So like if you sneeze, you want to try to, it's kind of gross, but you want to try to sneeze with your mouth open, so it's not like creating that pressure inside your mouth that could potentially move fluid between the nose and the mouth. If it were to happen and you were to have like a little, what we call a communication, where it's like, something, either the saliva is going into the nose or vice versa, basically you're just going to do the same thing. You're just going to wait and stop and try not to do whatever it was that caused that, whether it was, sneezing, or maybe you were trying to drink a really thick smoothie through a straw or something. You want to avoid those things until the holes seal off. And then after that, it's just going to heal up normally by itself. So knock on wood, I've never had a patient have an issue where the hole doesn't heal up. It's just a matter of how long it takes. I think over the last 10 years, we've had 2 patients that like when they were drinking something, they noticed, oh, I felt a little air, come into my mouth, and it was like weird, And so if that's the case, you feel a little bit of air, like if you're, sucking on a straw or something like that, then that would be a sign, okay, yeah, that communication is still open. And so again, you take it easy and just give it a few more days to seal off completely before doing whatever you were doing that caused that.
Got it. Okay, so let's see here. We've got common concerns or misconceptions about the Marpe expansion that you might want to address.
Ooh, common concerns or misconceptions. That's a great question. Well, one I get a lot is that oh, if I expand my jaws, it's gonna cure my sleep apnea regardless of what it is. And so patients just come in, and I think that they want, they're desperate. They want a fix or a solution.
Right.
And although there's lots of improvements and with sleep apnea, depending on the type of sleep apnea you have and the severity, it's definitely not something that typically is going to cure sleep apnea completely, especially if it's like moderate to severe. It'll typically improve it and make it better, but certainly there are limitations to what it can do from a sleep specific standpoint. So that's one thing. Another misconception, I would say the biggest misconceptions come from what expansion is, the orthopedic expansion versus the dental expansion or tipping the teeth. A lot of patients come in and they're like, oh, well, I already had an expander. And it's like, you ask them, well, what kind of expander did you have? How old were you? What did it look like? How did it fit? And a lot of the, quote unquote expanders that patients have had are really just appliances that move the teeth, which isn't going to accomplish anything that they want as far as moving the jaws. So that would be probably the number one biggest source of confusion with patients that come in is, what type of expansion they either have had or that they want or need, and helping them to understand that process.
All right. Let's see here. So we already talked about, so how can it impact the sleep quality with sleep apnea?
Yeah.
Yeah. Tell
So
me how
so
that
so
works.
yeah. So the biggest and most let's see what the right word is. So basically, the biggest benefit from an airway standpoint that you'll get with expansion is nasal breathing. And so with sleep apnea, oftentimes constrictions in the nasal passageway cause or elicit these apneas to happen. Okay, so it's not on every patient, right? So that's why a lot of patients who come in, if they've never had a sleep study, I'll tell them first, hey, go get a sleep study. Let's see what's going on with your sleep apnea specifically. When is it happening? Is it when you're on your back? Is it when you're on your side? And how severe is it? How often is it happening? So if you have nasal constriction, and sleep doctors can walk you through this, they can do tests to see how constricted the nasal passageways are. It's called like nasal rhinometry. They basically hook up a device to your nose, you breathe in and out, and they can tell you, depending on A, where your jaw is, or B, when you breathe in through your nose, how constricted that is. And if it seems likely that that constriction is leading to these apneas that you're having, then as we expand the upper jaw and it becomes easier to breathe through your nose, then those apneas reduce or are eliminated, again, depending on how severe they are. Functionally, that happens two ways. So one, as the jaw gets wider, it's the same bone, so the internal nasal passageways get wider. And then the other way is that, especially in younger kids, the tonsils are connected to the tonsillar pillars, which are basically soft tissue folds that are attached to the back of the top jaw. Okay. So as the top jaw widens, the soft tissue that holds the tonsils widens as well, and so that essentially widens where the tonsils are, and it can create more room back near the base of your tongue and or where the tonsils are back there. So that's the physical mechanism on how that expansion can help with airway or sleep disorder breathing problems.
Yeah, you think about it, I had my tonsils out when I was a baby, so I already had that part taken out. Then obviously I did, the expansion. I'll be doing another sleep study in November is kind of what we were thinking after I've had this out, the expander out, had the tongue tie release. So I'm attacking my sleep apnea issues, multiple prongs. So I'm hoping that that was the other thing when they did my C scan is they also checked. Luckily, I didn't really have any nasal issues, but because you're right, oftentimes people think it's just this or the tongue, and it could be some of that, but sometimes it's all in here.
Right.
Okay.
There's other things besides the small maxilla that cause constriction as well. So that's another one of the things that we're going to be looking for: severely deviated septums and or allergic inflammation that's severe. Maybe it's not the actual width of the nose, but the soft tissue in the nose is inflamed due to allergies. So all those things need to be looked at and evaluated before you just jump in if sleep is your number one concern. And so that's why a lot of patients that come here like, hey, I want you to expand me, so I can cure my sleep apnea. You have to start asking those questions. You have to start from the beginning, get the right diagnosis. And if it turns out that nasal resistance is the biggest deal with the apnea, then yes, it's going to help tremendously. But if it's something else, then that's going to be like a referral that we'll make, to see another provider that might be able to help with what else might be going on.
I had, obviously for me, I started out with it being the tongue tie issue. The fascia was so tight. I have chronic shoulders, neck, and pain. And I have to tell you, my body's trying to find its new normal now since I had the tongue tie release. I'm about 2 weeks out. But I can tell you like that, even just the neck and shoulder, even a hip that was bothering me, like night and day. And I noticed from the expansion before I had the tongue tie that I was just feeling, I'd always dealt with TMJ and super tight. I was already feeling better, not from the shoulder standpoint, because that was just the tongue tie, but prior to the tongue tie release with this expansion, I was already feeling, I was definitely sleeping better. I still had sleep issues, but I was definitely noticing like, wow, I can breathe better. And I never even thought that I had a breathing issue. But when it expands, you're suddenly like, God, I can breathe better. So it's all those side benefits. And I was thinking, even if things don't improve to the level that I would love it to, I'm noticing enough improvement to be like, it has been worth it.
Absolutely. And some patients, like I say, they come in and they know, they like, I have never been able to breathe through my nose. And other patients like yourself, I mean, it's like, you've never really known it's an issue, and then all of a sudden you experience what it's like to be able to really breathe through your nose, and it's like, wow, this is different. Like I didn't even know this was possible. And so yeah, definitely, it's the experience that patients have is different depending on what they knew coming in, essentially.
Exactly. All right, so we've got let's see here. The relationship between TMJ disorders and orthodontic treatment? Because I also feel like the tongue tie is a missed, you know, for me, I'm like the advocate for the tongue tie release, because I feel like most doctors aren't even talking about it, especially with TMJ. They're doing all these other kind of things to try to fix it, but that should have been part of the investigative reporting. So how do you feel that how does it correlate?
Yeah. So the TMJ disorder, so the jaws are very, I mean, it's not something that, you can gain a huge understanding of in 10 minutes, but I'm going to try to break it down as simply as possible. Most of the instances of jaw pain and problems are related to the bite and things that are happening with the way the teeth fit together and where it forces the jaw to fit together. So example is like if your teeth don't fit together right, then your jaw can never really relax and feel comfortable. And because it can't relax and feel comfortable, you end up, whatever you manifested that in some way, whether it's grinding or clenching or whatever it might be. And it's this process that just continues to get worse and worse and worse. And the more, what we call parafunction that you have, whether grinding or clenching, the more it causes inflammation in the joints. And so, kind of like the simplest way, or the first thing that we need to do in order to kind of stop that process is figure out where your jaws are comfortable and relaxed. And so an expander, it kind of gets you off your teeth, right? So when you started your treatment, your upper jaw was expanding and your lower teeth had aligners in them. So your teeth weren't able to fit together the way that they always had. And because, your teeth weren't telling your jaw where it had to go to fit together, your jaw could go wherever it wanted to. And so it's able to relax.
Yeah, like right now, the same now. Like I've never in my entire life been able to just relax, and I still have I still have that contraption in my mouth and aligners, and just the fact that I feel a relaxed feeling versus always being sore and tight and hurting.
Absolutely.
It's amazing.
Yeah. And so once that jaw is relaxed, then all we have to do is put the teeth back together to fit where your jaw is relaxed. And so that's that whole process of moving the teeth in the end. So that's what we're still doing with you. So as we go along with the aligners, now that your jaw is relaxed and where it wants to be, the new scan that we took the other day, to answer your question there, that scan was captured in a place where your jaw is comfortable. So now the movements that we make are going to get your teeth to fit together in that location where your jaw is the most comfortable.
I always wondered that, because I'm thinking, because I said, like, I'm kind of biting heavy on this side. I'm thinking, how in the heck? I know you take the scans and all that, but it's magic. The tools you guys have now, the technology is extraordinary. Let's see here. TMJ, let's see here. So I know that, well, actually, before I talk to resources, actually, I have two other questions. Someone said, I'm thinking, why Marpe expander as opposed to double jaw surgery?
Yep.
Is this a case-by-case patient preference? Is a question that was submitted.
So basically, there are things that double jaw surgery can do that Marpe expanders can't do. And so it really is patient specific. So if your upper and lower jaws are set back, let's say, 10 millimeters from the norm, there's no way possible that a Marpe expander is going to be able to A, move the top jaw that far, and then B, the Marpe expander doesn't move the bottom jaw at all. The bottom jaw can relax and move within the jaw joint, but the actual position of the lower jaw is not changing. So if you need the lower jaw position to change, maybe you need it more forward or more backward, then that you're going to be a candidate for surgery. Or if there's changes that you want to see in your face, sometimes patients will have asymmetric growth where one side of the jaw grows more than the other side and the chin is off to the side. Or maybe there's a severe cant of the top jaw or something like that that the patient wants to correct. Well, an expander alone is not going to change the position of that lower jaw. So that would be something that jaw surgery is required to do. So I would say, there's a certain percentage of patients who would have the option between a Marpe and a jaw surgery, and those are the patients that tend to seek it out. Because if they don't want jaw surgery and they are a candidate for Marpe, like that case I showed you up here, 10 years ago, this person, the only option would have been jaw surgery. That's the only way we could have gotten the teeth to fit together, is having that jaw surgically widened. But because he didn't have any changes with his face, there were no asymmetries, there was nothing else that needed to be done with a jaw surgery procedure. So if we could get the correction just with the expander, then that saves him from having to go through the additional expense, risk, and everything else that's associated with jaw surgery.
Okay.
But yeah, go ahead.
So it is if you have a choice of, like, you have two options, is the choice less painful, the Marpe, or the jaw surgery?
Absolutely. So with the Marpe expander, I mean, and your experience is very similar to most people's experience. Usually like that day, you're not going to want to go out and do a lot, right? You're going to be, at home just kind of taking it easy. But I've had patients return to work the following day. And so there's not a significant amount of downtime depending on what type of work you do and how comfortable you are, resuming your life afterwards. With jaw surgery, the total recovery is typically about 6 weeks. And there's usually about a good 1 to 2 weeks where you're out, you're down. You know what I mean? So you're recovering essentially. And that's because it is a major surgery. It's done in a hospital. You're under general anesthesia. The bones are literally, basically removed from the skull and set where they need to be set and then reattached typically with surgical plates. So it's definitely a much more involved procedure. And I'm so grateful for the surgeons that we work with that are able to do these procedures. But they are very technically complex. And because they're a more involved procedure, there's more risk with those procedures and the recovery is longer. So if you can get the results that you're looking for with a Marpe, that's going to be a much less invasive and better experience overall as far as getting the results. But if your case requires more movement than a Marpe can handle, essentially, then that's when you'll be looking at doing jaw surgery. But what I'll tell you now is that even surgeons have a hard time widening the jaw to very large amounts, like over 10 millimeters, let's say. And so if you're a patient that has a very, very narrow jaw and you have other things going on, maybe with your lower jaw or with having them set back, then sometimes what we'll do is we'll actually do the Marpe to help get the width and reestablish as much width as we can with the Marpe. And then after that, the surgeon will take it the rest of the way and finish the jaw surgery afterwards. So patients with, let's say, severe sleep apnea, if they want to try to get off CPAP completely, maybe both of the jaws are set back and the upper jaw is narrow, we'll start with the Marpe to get the width of the upper jaw to improve the nasal breathing. And then after that's completed, they'll do jaw surgery to bring everything forward. And in cases like that, you can, completely resolve their sleep apnea very predictably. And so that's kind of how the two interact with each other. But it's definitely not exclusive. So patients who have big discrepancies, that's what I'll tell them. I said, hey, we can start with the Marpe and we can see. This patient behind, I thought we were going to need jaw surgery to get him completely corrected with how big the discrepancy was, but he responded really well. And so at the end of the day, we didn't end up needing to go to jaw surgery. So that was a great option for him that I wasn't anticipating having. But sometimes, it happens that way, and that's great. I mean, that's just less everything that he has to do.
Awesome. Okay, so here's, let's see. They asked, do I have myofunctional therapy with treatment? And I said, yes. Now, let me ask you something. I was doing myofunctional therapy for my tongue tie to strengthen the tongue, make sure that everything is strong because my tongue was so lazy, not, having been tied down. Would someone be doing myofunctional therapy? Would there be a reason to be doing that? If they don't have a tongue tie issue, but they're coming in for a Marpe or some kind of other dental issues?
Yeah, so it really boils down to what the indications are and why they want the expansion to begin with. So with airway-related problems, myofunctional therapy is usually a good idea because the stronger the tongue muscles are, and it doesn't, if you just think about it, it really doesn't make a lot of sense, but the research has panned this out. So you think like, oh, well, when I'm asleep, my mouth could be open, it's set back, my tongue's going to be relaxed. But there's a lot of research that shows, and on the medical side as well, if you strengthen the posterior tongue muscles, your tongue will stay more forward in your mouth even when you sleep. And so like crossing over to the medical side, they have FDA-approved devices. One of them is called Excite, which is basically a TENS unit for your tongue. It kind of shocks your tongue and strengthens the back muscles. But that's FDA approved for mild to moderate sleep apnea. And you use it during the day, like 20 minutes. But what it does is it strengthens those back tongue muscles. And even when you sleep, it keeps the tongue more forward within your mouth. So myofunctional therapy does the same thing from a airway health standpoint, meaning that if you're good with your exercises and you do all the exercises, you can A, strengthen the back muscles of the tongue, and B, learn how to keep your tongue in the roof of your mouth, which does translate over into your sleep at night. So for that reason, it's highly indicated. Now, if you're coming in wanting a Marpe and you don't have any airway issues, maybe you just want the aesthetics, or maybe your teeth just aren't fitting together, the myofunctional therapy may or may not be indicated. So if you don't have any functional issues, you're swallowing fine, and there's no other issues that you're worried about from a functional side, then you may be able to have the expander without any myofunctional therapy, just to get the bones and the anatomy and the teeth corrected.
Got it.
And so it really does,
even,
yeah.
yeah, I didn't even realize what, like, even when I swallow, even Minette was looking at doing my assessment with my, she's like, do you see how you swallow? And like, I had to relearn, I'm still relearning all of that, like, because of that fascia in the tongue. I was swallowing, you'd see me, I'd like, when I swallow a drink, I mean, it was just crazy. And I never even realized it because I've had it my entire life. But I will say to those ladies out there and men is that as much as it's a pain in the butt to do all the exercises, it's also like face yoga. And let me just tell you, like I noticed prior to the Marpe, it was pulling thing up, tightening. There's beauty benefit to that as well, not just from the sleeping standpoint. It's a good thing. And then let's see, people already asked, was it hurt, uncomfortable? I already answered that. Okay, so I guess what I'd like to wrap this up with is a couple of things that are really important. One is, to me, the most important thing. I have been very blessed to have an incredible, an extraordinary team. Dr. Zaghi, Dr. Manuel, and Minette. I also have Dr. Toder, who is my craniosacral doctor I've been working with to get my body back in alignment. The importance of working with someone really who is on top of their game. There are a lot of people out there, just like there are doctors, dentists that are just doing the snip with the tongue tie without any myofunctional therapy, without any x-rays, which can be catastrophic.
Absolutely.
And I know when I talked to Dr. Zaghi, when he recommended you or his doctor, it was like, that was kind of it. Like, I mean, I know he's got a few people in his arsenal, but in my area, he's like, you don't want to mess around with this. We started off with talking about how you kind of specialized in this, but I really want to hit home to people out there that are listening or curious. Obviously, there are people that are really good at doing this, but I would say that is a small group that you really want. You know, why is it so important to have someone that really specializes in adults in this experience that doesn't willy-nilly do it? What the difference can be between going to whoever or the cheapest person versus someone who is really honed in on this?
Yeah, the biggest thing is that, when we think about how technique sensitive the procedures are, right? And so, there's a lot that goes into expanding the jaws more so than goes into just expanding the teeth or moving the teeth, right? So all of us as orthodontists, we're trained to move teeth, like that's what we do. But, in residency, even today, the information and the education on learning how to move bones predictably, like we do with Marpes, is very, very limited. Recently, I launched, at the end of last year, I launched a course for dental professionals to learn how to do this, because that knowledge gap is just getting wider and wider. You have a few individuals across the country who really specialize in this and take the time to learn. But really, this needs to be something that's taught in all of our orthodontic residencies. Our new docs need to be learning this. And the more and more research that's published and comes out, the more and more the educational institutions are going to need to incorporate this into their curriculums. But long story short, I mean, there are things that can go wrong with expansion. And if you're with somebody who doesn't know what can go wrong, then that's kind of risky, right? Because then you might be the first patient that goes wrong on, if that makes sense. And so you really, like if it's normal braces or aligners, there's a lot less things that can go wrong with that. When you're actually moving the bones of the face, there's a lot of things that can happen. And so it is important to see somebody who has taken the time to learn about all of those things, who's looking at their cases in 3 dimensions and understands like how the bones change and what can happen as they change. And at the end of the day, it's just for your own peace of mind and security. I would say the same thing about if you're going to seek out jaw surgery. So, surgeons, oral surgeons who do orthognathic double jaw surgeries, all surgeons extract wisdom teeth, essentially. Most all of them do. But not all of them do orthognathic jaw surgery procedures. And so when you're seeking out, and some of them will just tell you if you call them like, hey, I don't do that. But when you're seeking out someone that's going to do a jaw surgery, if you decide to do that, double jaw surgery, you're going to want to see somebody that does a lot of that, okay, that has a lot of experience with it, that utilizes the technologies that are available, 3D advanced guided imaging, all those things to get you the best result possible. Because at the end of the day, the potential complications are not worth the risks of going to somebody who doesn't do a lot of this. So you definitely want to feel comfortable where you are. And again, make sure you can get the best result possible and with the least amount of risk possible.
Okay, so the next question that's never fun to talk about, but it's important and people ask about it all the time. And I know it varies, but let's talk about cost.
Sure.
Let's talk about kind of a typical range, because it depends on the area where you live, but a really qualified, um, doctor that does Marpe expansion. Can you kind of give us a range of cost?
Sure. Yeah. So typically, and again, I really don't know what other people across the country charge for their expansion, but expansion in our office, skeletal type expansion, Marpe type TAD based expansion is going to add somewhere between $2,500 to $6,000 to your orthodontic treatment plan. So, whatever the cost of your orthodontic treatment plan is, plus about $2,500 to $6,000, depending on, again, all of those factors, how involved the design of the Marpe needs to be, how many TADs there needs to be, basically how complex your case is. So that's kind of the range of what it'll add to just your normal like braces or clear aligner orthodontic treatment fee.
So yeah, so
Here.
it could be 10,000, it can be 15,000, depending on you're talking with your braces, with your kind of all of that together. I've seen as much as 20 some $1,000, depending
Yeah,
on
I've
where you
seen that
are.
I've seen that online too. And
Yeah.
again, like I say, I don't know how everybody else does their fees and whatnot, but yeah, typically, so let's just say your case was going to be about $7,000. You needed an expander. Like if it was a teenager, again, it could be anywhere from $2,500 to $6,000 more than that, depending on what type of expansion you needed and how complex your case was and how long your overall treatment time would be.
Now I know you guys have been extraordinary, and it was the same thing with my daughters when they had their braces with Dr. Hamilton years ago. Is that you have a really beautiful, a very gracious kind of payment plan for patients to work through. And I know every dentist, some are like, we only go through like care, kind of separate where you have to get a loan and all of that. You guys, your office for the most part have really, I think, very agreeable plans so that it can make it affordable for others. And a lot of dentists don't.
Sure. Yeah, I mean that's not my specific area of expertise. Our
Right.
financial coordinators do all of that, but yeah, essentially they look at the insurance that you have, they maximize any benefits that they can get from the insurance, and then they work out a payment plan that's comfortable for you, essentially. So we try to make that as friendly as possible and as interest-free financing, and so essentially it just allows you to be able to hopefully allows you the most comfortable options, financial options possible.
Okay, so let's say here's kind of my closing question. You are amazing. I highly recommend you. How feasible is it for someone to come in from out of that wants to do this with you, that lives out of state? Is that possible? And what would that look like as far as, because I know I don't have to go in the office that often. So is that possible? Because we can give hope to people out there that say, hey, I want to go see Dr. Manuel.
Sure. Yeah, we're looking at a couple things right now. So we're in the process of creating an online consultation platform where patients from other places can submit photos and X-rays, and that would allow me to go through those and give them an idea. Just the baseline. Are you a candidate? Why or why not? What are the risks involved? And then after we establish that baseline, then we could potentially look at working with, a provider in their area, potentially doing, it's possible. I guess the short answer is it is possible to have treatment. One of the things that's important though is, if you're going to experience a complication, typically it's within the first couple weeks after the expander is placed. Okay. And so if you fly in and you have a procedure done and then you fly back out and, you're not available, you go back to work, that can create challenges if you were to have some type of concern or issue come up. That I can't, put my eyes on and see with you in person. And so as far as like, treating patients who are from out of state, we've done it before. We don't do it a lot, but we're looking at implementing processes so that we can feel more comfortable doing that and working in conjunction with, an orthodontist area, essentially. Exactly. Right. And so we could work out the expansion part of the treatment plan here, and then we could work with an orthodontist to finish all of the tooth movements and everything else in the future. But right now, step one for us is just providing that online consultation platform, because there may be patients who, want expansion that aren't a great candidate. And there's definitely, some patients that are higher risk versus lower risk. And so for those patients who are lower risk, who are good candidates, we are looking into being able to do that in the future. But step number one is getting that online consultation platform established so that we can take a look before you have to fly all the way out here.
Got it. Well, this has been so awesome. I'm so grateful that you took the time to have the conversation with me. I don't know if there's is there anything else aside from your Dr. Manueli at Hamilton, is it Hamilton Manueli Orthodontics?
Hamilton and Manuel Orthodontics.
And
Yes, you
yes,
got it.
on Buffalo Drive in Las Vegas. And there you can, HM Ortho is the, I'll tag it in the notes below, is their Instagram page. And he does great content. You can look at, you have a YouTube channel,
That's
right?
correct. So the YouTube channel is Vegas Ortho Doc. So you can go on there, and there's a lot about early expansion. There's some about skeletal expansion and some other topics that are more directed toward doctors. But yeah, so Vegas Ortho Doc is the YouTube channel.
Okay. And then if you guys, I've been asking all along if you have questions, and I've been an open book anytime. If anyone ever has a question about my experience with tongue tie, with expander, with the aligners, feel free to drop me a message. You can also, if you have a question for Dr. Manueli, you either find him or you can DM me and I'll make sure that we get it to him. If you watch this at a later date and say, I have some questions. I mean, my whole point is to share my journey so that I can help others, because this has been life-changing, and I'm not even finished. It's been life-changing for me. And I know there's so many people out there suffering with various things, and we all know that everything starts with the mouth, like that. You know, the chronic, everything else trickles down. Our health, everything begins there. So I think that so many people are afraid of the dentist or don't have dental insurance. I mean, there's a whole host of things that are going on, and it ends up creating so much angst, you know, so much disease, and and illness within the body. But it can be addressed in the mouth. And so this is
Absolutely.
such an important conversation. Is there anything else you want to add before that I may have forgotten? You want to end
No,
this?
I mean, I appreciate you. Thanks for having me on. And you being so open with sharing your journey certainly is helping other people to get information that they wouldn't otherwise be able to have. So, I appreciate you being a warrior for good health and proper jaw alignment and breathing and all those things. And so, keep up the great work and everything that you do. And yeah, we appreciate you.
And then also, everyone, just so you know, like you can see that it's funny because I had a lot of people say, like, I got people love my Gap, and I got every kind of Gap joke you could think of, that I work at the Gap store. You could put a football through that. That's where my scanner was missing from work. I mean, I got all the Gap, all the ha-has, but it closed back up. So the biggest thing, I was most worried about the Gap. And honestly, it was much better. I was self-conscious. It was the most, honestly, it was one, besides my gray hair, I mentioned this to Dr. Zaghi, that learning the self-acceptance when when you're always your appearance and feeling pretty and beautiful, when you suddenly have this big gap, it's a renegotiation of everything that you thought about, about beauty and self-acceptance. And so it's been such a beautiful journey. And I mean, literally it's been great. And look, the gap does close back up. So that is a temporary thing for really huge results. Don't let the gap for a second put you off. If I can do it, someone who is very much about her entire life is that her worth is like how I look, am I pretty enough, am I lovable, all those things. Don't let that, if I can do it, you can do it too. It is so worth it. It is so worth
Well,
it.
you've done amazing. Yeah, we're so excited for you.
Yeah. Anyway, well, have a great rest of your day, and I'll be saving this, you guys, so you can come back later and like I said, answer any questions. Just drop them below. So thanks
Awesome.
again.
Thank you.